Here's a wild idea. What if the most important part of medicine isn't the treatment? It's the conversation before the treatment. Today, I'm diving into Canterbury versus Spence, 1972, one of the cases that reshaped modern informed consent. Welcome to Once Upon a Case, because the law isn't just for lawyers, it's for everyone. A risky operation, a life-altering outcome. The court asked a simple question with massive consequences. Who decides what risks matter, the doctor or the patient? The case starts with Jerry Canterbury, 19 years old, dealing with persistent back pain. He saw Dr. Spence, a prominent surgeon. The proposed fix, a laminectomy, a spinal surgery. What Jerry says he didn't get was a clear warning about a serious risk, paralysis. After surgery, Jerry reportedly fell while trying to use the bathroom, and he ended up partially paralyzed. He sued, arguing that if he'd been told the real risks and alternatives, he might have made a different choice. Back then, the norm in many places was, the doctor knows best standard. Disclose what other doctors typically disclose. Sounds reasonable, until you realize that standard puts the power to define enough information entirely in the hands of the profession delivering the treatment. The D.C. Circuit flipped that script. In 1972, Judge Skelly Wright wrote the opinion that became a landmark. Informed consent is about the patient's right to decide. The measure isn't what doctors customarily say. It's what a reasonable patient would want to know to make an intelligent choice. So what must be disclosed? Material risks, alternatives, doing nothing when that's relevant, and doctors can't hide behind custom to skip the tough conversations. There's a narrow exception called therapeutic privilege, where disclosure might seriously harm the patient's health. But the court warned, use it sparingly. It's not a free pass to withhold inconvenient facts. On proof, the court made another big move. You don't always need expert testimony to say disclosure was inadequate. Jurors can understand whether a risk matters to a reasonable patient. Expert testimony is helpful to explain the medical facts, the nature of risks and odds, but not to define the legal duty. Causation matters too. The question isn't, would this specific patient say no now? It's objective. Would a reasonable person, properly informed of the material risks and alternatives, have declined or chosen differently? So what's the impact? This case helped power the shift from paternalism to patient autonomy. Today, consent forms, risk discussions, second opinions, those aren't just paperwork. They're the legal and ethical backbone of modern care. Bottom line, Canterbury versus Spence says the decision is yours, but only if you're given the information that truly matters. Ask questions, demand clarity. Because the right to choose is only real when it's an informed choice. Thank you for watching. If you want more cases that quietly changed everyday life, hit like, subscribe, tap the bell, and let me know which case to cover next.